Some people dream of making $500 million. Others just bill Medicare until the government finds out. Welcome to the story of Alexandra Gerke and her husband, Jeffrey King, a Phoenix power couple who turned wound care into a high-stakes con, fraudulently billing Medicare and other health insurance programs over $1.2 billion and collecting close to $615 million. The hustle, you ask? Wounds, grafts, and kickbacks. Ms. Gerke ran two companies, Apex Medical and Viking Medical Consultants, that recruited sales reps to locate elderly patients with any kind of wound. The goal? Order expensive amniotic wound grafts, whether or not they were medically necessary, from a specific kickback-paying distributor. Gerke dictated that all grafts had to be 4 by 6 centimeters or larger because Medicare and other payers reimburse based on wound graft size, and maximizing billable centimeters meant maximizing illegal profits. Gerke then referred the patients to a company co-owned by her husband, Mr. King, which contracted with nurse practitioners. Gerke and her husband, Mr. King, directed the nurse practitioners to suspend their own medical judgment and apply all grafts ordered by the sales reps, even when medically unreasonable and medically unnecessary. Healed wound? Grafted anyway. Infected wound? Throw a graft on top. Wound not responding? Keep slapping grafts on it. Gerke pocketed over $279 million in kickbacks from the graft distributor and spread tens of millions of dollars in illegal kickbacks to her sales team to keep the scheme rolling along. But then things came to an end with Gerke and King arrested and charged. Both pleaded guilty to conspiracy to commit healthcare fraud and wire fraud and agreed to pay restitution totaling more than a combined $1.2 billion. They also agreed to collectively forfeit over $410 million in funds they obtained from the fraud. But that's not all. They each face a maximum penalty of 20 years in federal prison. Here's some lessons from the scam, whether or not you can tell the difference between a wound graft and a walker. The general lessons of Gerke and King's fraud and downfall are applicable. Seems simple, but kickbacks are illegal. It's a simple rule, but one that fraudsters keep forgetting. Seemingly innocent physicians and other practitioners often get swept up in the scam by not questioning why someone other than the payer is paying them or giving them something of value. Would a pharmacy really loan you a portion? Just because a medical procedure is billable doesn't mean that it's ethical or legal. When wound care starts looking like a Wall Street hedge fund strategy, something's off. But it doesn't have to be wound care, and it doesn't have to be you who's doing it. For example, many a physician has been caught up in a scam run by his or her employees within the practice. The money didn't hit your pocket, but the claims went out under your name. Facility-based practitioners aren't exempt either. For example, anesthesiologists have become embroiled in fraudulent billing scams as a result of medically unnecessary cases being performed by scamster surgeons at ASCs. In other cases, the medical cases, the surgical cases, were never actually performed, but they were billed, including under the anesthesiologist's name. The government is watching. With healthcare fraud investigations ramping up, the feds are cracking down. If you think you can sneak $1.2 billion past Medicare, think again. Employees will talk. These scams often unravel because someone on the inside decides they'd rather be a whistleblower than an accomplice. Medicare might be a retirement plan, but Medicare fraud isn't. Shortcuts to healthcare wealth can lead straight to a jail cell. Compliance isn't optional, and the government always gets the last word.